Okay. What is your name?
Austin Lakin.
Hi, Austin. I am Savannah. I am a student athletic trainer at Nebraska Wesleyan. I see that you are breathing and that your airway is not blocked because you were talking to me. Let me see your fingers, please, so I can check your circulation. You have good circulation. So, where is your location of symptoms occurring?
My head.
Your head? His head. Have you ever had a concussion before?
No,
Not that you remember?
not that I remember.
Okay, that's good. That means that this is your first, head trauma. What, sport do you play?
Football.
Football. What position?
Linebacker.
Linebacker. Nice. Well, I don't see any bleeding, and I don't see any bony deformities. I don't think. Let me look. Nope. You don't have any raccoon eyes, and I don't happen to see no fluid coming out of your ears.
Okay.
So that's good. What was barking? Your head is positioned okay. You're fine with that. Okay, so put your arms out. Do you feel my touch?
Yeah.
Do you feel my touch?
Yeah.
Yes? Okay, so your dermatomes are good. Now, can you move your arms? Don't let me push down on them. Can you move your fingers? Don't let me push in on them. Can you move your legs? Can you move your toes?
Yeah.
Good. That means your dermatomes and your myotomes are both good. Now we're going to check your reflexes. Sorry, I don't have a tool for that. So I'm using this rock. Relax yourself. Wow. Good reflexes. Now, is this tender at all?
Yeah.
Up here?
Mm-hmm.
On your occipital bone.
Yep.
Did you get hit back there?
Yes.
Oh. Okay. But you don't have any tenderness in your neck. Do you have any tenderness in your throat?
No.
That doesn't bother you at all?
No.
Over here? No?
No.
Okay. Okay, so you said you were playing football in a game?
Yes.
During the game, what were you doing? Were you running just prior to getting hit?
Yes.
Did you get tackled? Or just hit?
Just hit.
Okay. And you got hit in the back of your head. How long did you get from the field to the sideline? Like, how were you able to get from the field to the sideline?
I just walked.
You just walked there? Okay, so now I'm going to do a memory thing. I'm going to say 5 words, and you're going to repeat them back to me. We're going to do that 3 times. Ready? Elbow, apple, carpet, saddle, bubble.
Okay. Elbow, apple, saddle, carpet, bubble.
Okay. Elbow, apple, carpet, saddle, bubble.
Elbow, carpet, saddle, carpet, bubble.
Okay. Last time. Elbow, apple, carpet, saddle, bubble.
Elbow, carpet, saddle, carpet, bubble.
It's like 4 for 5 on all of them. Okay, so your symptoms. Do you have a headache at all?
Yeah.
Is it pretty severe? Is it like on a scale from 1 to 6? 6 being severe.
About 4.
feel dizzy at all?
Yeah.
Are you sensitive to light or sound? A little bit?
Neither.
Neither? Do you feel irritable?
Yeah.
Do you feel sad?
No.
That's good. Do you feel like you have any blurred vision?
Kinda.
Kinda? Okay. Those are just a list of symptoms that associate with having a concussion. There is some cognitive function. We're going to do. Can you do the alphabet backwards?
No.
What about the months backwards? You gotta do some of them. Alphabet or months?
And I'm terrible at both.
We'll pick one.
Try the alphabet.
Okay.
Z, X, Y.
What about months? Can you try the months? Starting from December.
December, November, October, September, August, July, June, May, April, March, February, January.
Okay. Now, I'm gonna say some numbers, and you're gonna repeat them back to me, but reverse. So if I say 1, 2, 3, you're gonna say 3, 2, 1.
Okay.
Okay. 4, 1, 3.
4, 3, 1.
7, 1, 1.
1, 1, 7.
3, 2, 5.
5, 2, 3.
Okay, good. So now we're going to do some balance tests. So you can stand up for a second. So now, I don't know if you can see this. Yeah, it's okay. You'll stand with your feet shoulder width apart. So you don't fall on it. So stand with your feet shoulder width apart. And then you're going to, I say put your hands on your hips. And then you're going to close your eyes until I say stop. And right now I'm looking for if you start to fall over, if you open your eyes, any sudden movements. Okay, try tilting your head back, keeping your eyes closed, chin up. This is called Romberg's test. Now from this position, try extending your arm out and touching your nose 5 times fast from the side.
Yeah.
Yeah, but extend it all the way out and then back to your nose.
Like that?
Yeah.
Okay.
Okay, you're good. Now do it with 1 foot. Yep. You don't have to extend your chin back yet, just close your eyes. Okay. Yeah. Now we're going to do tandem walking test. So this test, you're supposed to walk in a straight line, heel to toe, for 3 meters, so 9 feet. you got pretty big feet, so just walk 9 times, and then you're going to do a full 180 and then walk back 9 feet. But make sure, I'm gonna carry this. Okay. In this test, I'm looking to see if you wobble at all, if you take longer than 14 seconds. Okay, good. This also, with a person with a bad concussion, the examiner walks with them, and if the patient grabs the examiner, then that also counts as a point, and you count up how many points, and that determines if you have a concussion. Okay, the next one is called best test, so it's balance error scoring. I don't think we have a pad out here to stand on, so we're gonna pretend that we have one for the second 3, but the first 3, you're gonna stand feet shoulder width apart, and then hands on your hips again, and then close your eyes. Now from there, go to single leg stance. Okay, now stand tandem, like this. And make sure that you're balanced, you're not on one foot more than the other. Okay, you're good. And then if we had a pad to stand on, he would stand on the pad and do those same 3, but just on the pad. Okay. You can sit down now. It's a little crooked, but it's okay. So now we're gonna do cranial nerves. Maybe let's move the chair up here. Oh man. Okay. So the first one is olfactory, and that is to deal with smell. Do you smell anything different outside? Any like burning or anything out of the ordinary?
No.
Okay. The second one is optic. And optic is if you can be able to read or see things. So I'm going to stand here and just look straight at me, but tell me if you can read my numbers.
Yeah, 2, 1, 2, 2.
Okay, good. The third one is ocular motor, and that deals with pearl, with the pupil, to see if it responds equally to the light. So I have a pen light. I'm going to try to do it out here. I don't know how well it's going to do because we're outside, but look forward. Okay, they both responded equally to the light. The fourth one is trochlear, and trochlear has to do with upward eye rolling. So I'm gonna have you look at the tip of my pen and don't move your head, but follow it with your eyes. Okay. His eyes kind of went faster than the pen, but that's okay. The fifth one is trigeminal. I think that's how you pronounce it. That one has to do with the mastication muscles. So I'm going to touch your face with my pen, and you tell me if I'm gonna have you close your eyes though. Tell me if you can feel the touch.
Yep. Mm-hmm. Yep.
Okay, good. The sixth one, I think, is abducens. That also deals with eye movement. That is moving, that's lateral eye movement. So, tip of my pen, don't move your head, only your eyes. In a clinical setting, a lot of clinicians do all of the eye movement ones all together, so they'll, yeah. Anyways, the seventh one is facial, and so smile. Good. Both of them reacted the same, about the same. The eighth one, vestibulocochlear. That one deals with hearing. So I'm gonna go behind you, and I'm gonna snap my fingers in your ears. Tell me if you can hear.
Yep. Yep.
Okay. The next one is glossopharyngeal. That one has to deal with like taste, and so say ah.
Ah.
Yeah. You seem confused. That's a sign of concussion. Vagus is 10. That deals with gag reflex. So can you swallow? Good. And then accessory has to deal with the muscles of the like neck area. So what I'm gonna have you do is raise your shoulders up. Don't let me push down. Good. And then the last one is hypoglossal, and that one deals with tongue movement. So I want you to stick your tongue out and move it back and forth as fast as you can. Good. Alright, so do you remember those 5 words I told you earlier? Well, you're gonna repeat them back to me. If you can remember it.
All I remember is apple and bubble. And salad. That's good.
3 for 5. Yeah. And what else? Let's see. Do you remember what my name is?
Savannah.
Yes. And do you remember do you remember what team you were playing?
The Bengals.
Bengals. Okay. Sounds good. So, some clinicians use a SCAT-3. I would say that you are concussed and that you should take a test every single day. You can't return to play until all of your symptoms are to 0. You have no symptoms. And you will gradually go back into play. Once you have all of your symptoms to 0, you will do a couple of like physical tests, and the next day after those tests you will take another like symptom test, and if it stays all 0, then you will gradually work back into playing football. If not, then you have to wait until all of them are 0 again. So, thank you.